A Moderna mistake in Maryland, and it could mean hundreds of people now need to get a third shot. The vaccine was stored at the wrong temperature and may not be as effective as it should be. WJZ is live this morning. Annie Rose Ramos explains what happened and what you need to know. Annie Rose, good morning.
Hi, Tim. Good morning to you. Here is why this is such a problem. The Moderna vaccine needs to be kept at a specific temperature, a freezing cold temperature. But officials say these vaccines were kept at room temperature for over 24 hours. Now, that means that some members of the military will have to have a third dose of the vaccine in order to ensure that they're properly protected. A vaccination mistake at Fort Meade.
This was due to improper storage and handling of the vaccine.
Thursday, officials announced 800 doses of the Moderna vaccine were compromised and inadvertently administered.
Instead of going from the freezer to the refrigerator to store, it went from the freezer to room temperature. It remained at that state beyond the 24 hours, which calls into question the efficacy of the vaccine.
Colonel Tracy Michael says his department at Kimborough Ambulatory Care Center administered the bad batch of shots at McGill Training Center on April 7th and April 12th. At a town hall meeting, he says the 80 affected vials were handled by 2 people at the storage facility and not at the vaccination site. It wasn't until the staff members were moving things around when they made the shocking discovery.
They cannot guarantee that the vaccine will provide the full protection that it was intended to.
His team is now scrambling to reschedule appointments for a third dose. Doctors say if you got one of the affected doses, there's no need to panic. There are no known risks of getting an ineffective vaccine. Now, Tim, in the wake of this issue and this incident, officials say they are making some changes. They say they're adding more people to help handle the vaccine, and they're adding more training so that those folks know how to store it. Reporting live, I'm Annie Rose Ramos for WJZ.
Annie Rose, thank you. And taking a look at our latest numbers, fewer people are in hospitals across the state. The positivity rate also dropped. Another 1,200 people test positive for the virus. The governor says he is hopeful the case rates will continue to decline now that 4 million people in the state have a vaccine. Rachel Menitoff explains the new efforts to get everyone a shot.
This drive-through site at Ripken Stadium able to give out 3,000 shots every day.
Drove up, I wasn't even here 5 minutes before I probably received the vaccine.
It's giving out the Pfizer shot in an effort to get as many young people as possible vaccinated.
So 16 plus can get their vaccine and hopefully really bring that positivity rate down.
For months, Harford County Executive Barry Glassman has been pushing the state to open a clinic here in a county with a positivity rate inching closer to 7.5%.
We're hoping by next week that you'll be able to drive up and register right on site and get your vaccine so you don't even have to pre-register.
Baltimore City is also making it easier. Now you can show up at the convention center, no appointment necessary. Governor Hogan says Maryland has reached a milestone moment. While the overall positivity rate statewide is on the decline and hospitalizations are also down, the case rate continues to climb. He toured another major vaccine site in Frederick County Thursday and touted the state as having the best mask compliance of any other and having more than 82% of all senior citizens vaccinated.
We're making incredible progress on our vaccines. All of our health metrics are looking great as a result.
And originally, Governor Hogan said the state only had 4 people giving out shots, and that number has grown to more than 11,000. He says the demand and the volume is still really high. Reporting downtown, I'm Rachel Menitoff for WJZ.